Hey guys, what's up? Jim from the Pain PT here, and we're going to continue to go over a couple more infographics I have here in my possession. I've had them for a while. I think it's good to review these things so we can drive home this idea that a lot of chronic pain is due to your brain and nervous system and not due to local tissue issues in the tissues, acute pain, subacute pain. And I'm going to go over some of the research today, a little bit more, and about your body and how you can have so many things showing up on different scans and X-rays, MRIs, yet many people have these things and they don't have pain. So let's get to it. I'm going to pull up this here again. This is from the International Spine and Pain Institute, OPTP. And again, we're going to talk about these tissues, right? So last time we talked about the brain and nervous system and the alarm system. Today we're going to talk about tissues. And one of the things about these tissues here, if you look at the top here, over here, I feel like I'm a weatherman here, looking at the stuff. You can see that when you have an injury, you have a spike in pain. If you see that blue over here on this side, right up here, okay? And when your tissues heal, pain typically also goes down, as you can see that in the image here. Now, what happens with ongoing pain as time goes by from weeks to months, you can see here that blue line doesn't necessarily go down. The ongoing pain stays elevated even though the tissue healing has already subsided. You can see that white line over here going down, tissue healing. And you can see the blue, which indicates more ongoing pain. Now, what they say here, and you may not be able to see it, but what they say here is that after an injury, tissues heal and pain decreases. Ongoing pain is more likely due to an extra-sensitive nervous system. That's what we talked about the other day, about this extra-sensitive nervous system creating this ongoing pain that just goes up and up and up and doesn't want to subside. Now, in these tissues of the body, it's well established that many of the tissue issues found on scans are very common and play a very small role in how much pain you experience and how much activity you can do. So for you guys out there who are wondering about your scans and what they mean, take some of the stuff to heart here and look at some of the research data around this and how common it is in many of these different parts of your body. So we got things such as your neck here. I'm just going to go over a couple of these things. There's a lot of information. Basically, among people with significant aging in their neck scans, only 10% actually have pain. Okay, we look at the shoulder. People who've had successful surgery experience no pain and regain all movements. 1 in 5 still have a muscle tear. So even if people have had surgery and they've overcome it, 20% of those people still have a muscle tear with no pain. So same thing, people age 30 who have a shoulder muscle tear, only 1 in 3 actually experience pain or limited activity. These are all from different studies that have been done. If you look down here, low back pain, among people with no back pain, more than 40% have a bulging disc on their scan. Talk a lot about changes you see in the spine. In older patients, scans often show wrinkles on the inside, yet most people seeking help with back pain are middle-aged. Okay, so that speaks about aging, is that as we get older, these changes continue to develop and get worse actually, yet we don't see the same proportion of pain increasing as people age. It just doesn't make sense. Okay, we're looking at the hip here. Make sure you guys can see this. Among people with no hip pain, 75% of their scans still show tissue issues. In hockey players with no hip pain, 2 out of 3 have scans that show significant age changes to their hips. Okay, and we come finally over here to the knee joint. Among people with arthritis on their knee scan, only 50% experience pain. Among college basketball players with significant issues on their knee scan, 1 in 3 do not have knee pain. Okay, so what you're seeing, and there's a lot of evidence to show that unless your changes in your body are very severe, mild to moderate changes aren't really associated very well with pain. I'm going to show you one other infographic here that was put out by the Advanced Physical Therapy Education Institute. Basically the same thing, concerned about your X-ray or MRI findings and the untold truth of medical imaging it's basically what we're telling you guys is that you can't look just at your scans and go by what you see there. You have to put the whole picture together with your history and see what makes sense. So they basically talk about a lot of the same stuff here, all this different data about different parts of your body that we can scan. Everything from your lumbar spine, your neck, your back, your shoulder, your hip, your knee, your ankle, all these different areas. And I'm not going to go through all these things right now because it's basically saying the same thing, that a lot of findings we see on these scans are normal age related changes that happen to everybody. And it's only when we see significant changes that we can put our finger on that we can possibly associate that with pain. So if you guys are wondering about your scans, wondering about your imaging, get a second opinion. If it doesn't add up for you, doesn't make sense, then it's probably not due to that. Okay, it's probably not due to the changes you see on your MRI or X-ray. If the changes are severe in nature, then it may have an impact. It may be contributing to your pain, but even then, we're not exactly sure. We have to look at your entire history. So I hope that helps you guys, just to point you back to this brain and nervous system, which gets continually overlooked in modern medicine. We have such good imaging, and we're not doing brain scans, which if we did, it would change the game here because we could see the changes in the brain. I'm going to do another video at some point about the changes we see in the brain. I've done it before. If you look back at one of my early videos, I talk about a lot of changes that occur in the brain when we have chronic conditions. Okay, and so these are the changes that we can work on. They are reversible. They're not like a stroke or dementia or Alzheimer's. These things are reversible when we work on changing the brain patterns and nervous system patterns. All right, guys, put your comments here, put your questions here, and I'll talk to you guys soon. Take care. Bye-bye.